Good afternoon. My name is Yuen Tirapal, metric number 286903. We are from Group 7 and we will be presenting about the accessibility of healthcare in Malaysia. Speaking about healthcare, different countries have their own unique healthcare system. For example, the United States are private dominated with government programs like Medicare aid for specific groups. Whereas Canada is publicly funded, it also has a universal coverage, but private providers deliver care. In this context, the public and private sectors now make up Malaysia's distinctive dual healthcare system. All Malaysians, particularly those in lower income groups and those living in rural regions, should have easy access to healthcare services thanks to government funding for the public sector. Contrarily, the private sector typically operates in urban areas where demand and profit possibilities are higher. Through its public healthcare system, Malaysia offers all of its residents access to healthcare. In Budget 2023, the Malaysian government put aside 7.6 billion to upgrade and repair healthcare facilities, promoting health and also wellness initiatives. This is to boost the efficacy of medical treatments. In nutshell, to guarantee world-class quality healthcare service delivery, the public and private healthcare sectors will need to concentrate on increasing the investment in digital health, medical equipment, and healthcare technology during the next 10 years. That program is a component of a larger modernization effort focused on managing and communicable diseases, elder care, and also epidemic preparedness. Okay, moving on to the next part, which is the overview of health expenditure. Malaysia divides its health spending between the public and private sectors, each of which makes a unique contribution to the country's healthcare system. Public healthcare services, which include government clinics and hospitals located throughout the nations, get about 10% of the government's yearly budget. According to the Ministry of Health, Malaysia, the lower income and rural inhabitants in Malaysia especially benefit from the subsidized services. A BMI analysis also predicts that thanks to robust government banking for the industry, health spending in Malaysia will increase at a compound annual growth rate of 8.3% until 2028. With this, we believe that the lower income and rural inhabitants in Malaysia especially will benefit from the subsidized services made possible by these fundings. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Tarmizi bin Zakaria 286970. Now I will present comparative analysis that is affordability and coverage. First, affordability public healthcare is low cost accessibility for all. For example, outpatient service at public hospital and clinic are typically priced at RM1 for Malaysian citizen, and dialysis treatment in public hospital is either free or cost only a small fraction of what private facility charge, while the affordability of private healthcare is premium service at a high cost. Private hospitals are generally considered to offer higher quality service. For example, the cost of a cesarean section in a private hospital can range from RM8,000 to RM20,000. Next, public healthcare coverage is wide range but limited resource offer a comprehensive range of service accessible to patients from low and middle income group. The public healthcare system faces challenge in meeting the rising demand for healthcare service, while private healthcare coverage is focused coverage with specialized service. Private healthcare facilities are known for shorter waiting time and a higher level of patient comfort, with service often tailored to meet the individual need of patient. Private hospitals typically provide one-on-one specialist consultation. Accessibility in rural versus urban. Healthcare in rural Malaysia. Rural population are frequently scattered across extensive regions, with numerous settlements situated at considerable distance from the nearest hospital or clinic. Individuals residing in the most isolated region may require several hours or even days to reach the nearest healthcare center, especially when adverse road conditions or seasonal weather disturbance hinder travel. The healthcare infrastructure in rural areas is frequently restricted to fundamental facilities like klinik kesihatan, community health clinic, and klinik desa, village health clinic. The deficiency of healthcare practitioners in rural regions constitute a significant obstacle to healthcare accessibility. Rural healthcare institutions frequently have challenges in recruiting and maintaining physicians, nurses, and specialists. Why? Healthcare accessibility in urban Malaysia, urban public hospitals and clinic possess contemporary medical technology, encompassing sophisticated diagnostic apparatus and capability for tertiary care, including oncology treatment, cardiology service, and intricate surgical procedure. The private sector in urban regions offer an alternative to frequently congested public hospitals, delivering more individualized and expedited healthcare service. Urban inhabitants gain advantage from enhanced transportation infrastructure, particularly public transit systems that facilitate access to healthcare service. Proximity to healthcare facility diminishes obstacles to accessing care, whether for emergency, chronic disease management, or preventive service.
Moving on to the next part is specialized services such as oncology and cardiology, which is important in managing complex health conditions. Public hospitals provide these services but face some challenges such as long waiting times, a shortage of specialists, and limited resources. For example, a non-urgent procedure like MRIs can take up to 6 months, impacting patient outcome. On the other hand, private hospitals offer faster access, advanced technology, and a wider range of treatment. For example, like Panda Hospital and Prince Court Medical Centre ensure quicker diagnosis and cutting-edge care, but cater primarily to those with private insurance or the ability to pay. This highlights the disparity in access between the sectors, with public hospitals prioritizing affordability while private hospitals focusing on quality and speed. Moving on, we'll look at 3 case studies to understand how health expenditure impact the accessibility in Malaysia. First, the Klinik Desa program provides affordable healthcare in rural areas, focusing on basic services like maternal health and immunization. However, due to limited funding, this clinic cannot offer specialized care, highlighting the challenges of resources constraint in the public sector. Next, Pantai Hospital Kuala Lumpur represents the private sector's role in specialized care. It offers advanced treatment like cardiology and cancer care with their modern equipment. However, the high costs mean these services are primarily accessible to insured or wealthy patients, which raise a concern about equity in healthcare access. Finally, public-private partnership (PPPs) combine public funding and private resources to improve the healthcare access in undeserved areas. PPPs provide specialized services in rural regions using government subsidies to offset the cost, offering a cost-effective way to expand access while relieving pressure on public facility. This case study demonstrates how health expenditure shape access to care in both public and private sector.
Good day, dear doctor, and everyone watching this video. My name is Fatma Kumar, and metric number is 287053, and I'll be presenting the policy recommendations. The first policy recommendation would be to strengthen public healthcare funding. It is to increase budget allocation to address resource shortages, overcrowding, and also the lack of specialized services, especially in rural areas. The next would be to improve service quality, reduce waiting times, and enhance overall care for undeserved populations. The next would be to elevate hospital overcrowding by addressing primary and secondary care coordination issues. The next recommendation would be to expand public private partnerships, PPPs, whereby incentivize private clinics to operate in undeserved and rural regions, leverage private expertise and resources to fill public healthcare gaps, and to share medical equipment and facilities to enhance healthcare delivery. The third policy recommendation would be to introduce comprehensive rural healthcare incentives, subsidies, or vouchers for specialized treatments like cancer care and cardiac procedures. We bridge the gap in public and private healthcare, ensuring equitable access to advanced medical care. Next is supported target healthcare subsidies under the budget 2025 to improve affordability. The last recommendation will be to subsidize specialized services for low income groups. Financial incentives such as salary bonuses and housing allowance for rural healthcare workers. Career development, for example, training and certification, and urban specialized rotation programs. And the last would be to the infrastructure upgrades, for example, diagnostic tools, telemedicine, and rural healthcare centers. In conclusion, we look at the dual healthcare system, whereby the public sector it's inexpensive, it has broad access through initiatives like Clinic Desa, and it caters to rural and low-income populations. Whereas in the private sector, it has high quality and also specialized care with advanced technology, mainly serving urban and affluent groups. The challenges faced within the public sector would be limited resources, overcrowding, and uneven distribution of specialized services. Whereas in the private sector, the challenges would be the high cost limit accessibility for low income populations. So, the solution for that is to strengthen public private partnerships PPP to bridge gaps, ensuring healthcare access for undeserved communities. Next would be to leverage the strength of both sectors to create a more equitable system offering quality care to all, regardless of the socioeconomic status. That's all from us, and thank you.